Thank you for joining us, and welcome to this training series on Article 81 guardianship. In this series, you will learn more about guardianship in a medical setting, and this video will focus on medical decision-making and working with a guardian. I'm Jasmine Raming, Training and Education Staff Attorney at Project Guardianship. Our organization provides person-centered care for older adults and individuals living with disabilities and mental illness who need help making decisions. We also provide education, do research, and advocate for better policies and practices inside and outside the guardianship system. For more information, go to projectguardianship.org.
In this video, we'll be discussing a guardian's role in making medical decisions. This includes understanding the guardian's power, information sharing, and how a guardian makes medical decisions, whether those are routine, something major like surgery, or for end-of-life care. Even when a patient has a guardian, they aren't always given medical decision-making power for the patient. Any powers not explicitly granted to a guardian are automatically retained by the patient. This is why it's important to check the order signed by a judge to find out exactly which powers a guardian has. It's also important to find out how long the guardian's powers last. Some guardians not only have limited powers, but also a limited time frame. If the guardian has certain decision-making authority, but the guardianship ended, the patient regains the right to make those decisions. Regardless of which powers a guardian has or how long those powers last, and even if a guardian is making medical decisions, you should still communicate with the patient about their healthcare because they're the ones receiving the treatment. Plus, New York's guardianship laws were actually designed to provide the greatest amount of independence and self-determination possible. So a guardian will want to hear the patient's opinion if they're able to communicate one. Now, let's say a guardian does have medical decision-making power. Those powers will be listed in the section of the order outlining the personal needs powers of the guardian. It will generally say something like, make routine and/or major decisions. We'll go over the differences in those shortly. Here's an example of part of a guardianship order. Look at the top paragraph. While some orders may just mention routine or major decisions, others will be more specific, such as mentioning end of life or defining what major or routine decisions are. In this example, you'll notice the court specifically gives the guardian the power to consent to an order not to resuscitate. Relevant decision-making power isn't limited to treatment decisions. It can also extend to decisions related to safe discharge planning, like consenting to home care or consenting to short-term rehab. But as we mentioned in another video, a guardian can never consent to mental health or substance use treatment over a patient's objection, even if the guardian has the power to make medical decisions. What happens if a hospital finds a patient is unable to make certain medical decisions and they don't have a guardian with medical decision-making power, they don't have a healthcare proxy, and even further, the patient didn't leave any prior instructions? In this scenario, hospitals usually turn to the Family Healthcare Decisions Act to determine who can make decisions on that patient's behalf. This law outlines a list of surrogate decision makers in order of priority, including spouses, adult children, parents, and adult siblings. It may be confusing to see guardians on top of this list. What that really means is guardians with medical decision-making powers. If the guardian does not have those powers, the hospital has to move on to the next surrogate on the list. But what if there's no surrogate available? If the patient has a guardian, they'd have to go back to court to get authority to make medical decisions. This can take some time, but a judge will often prioritize these time-sensitive issues. Keeping the guardian informed of the patient's medical condition can help speed up this process. If a guardian knows they'll need authority for a specific decision in the near future, such as surgery, they can get started on the paperwork so they're ready to make that decision when the time comes. Even when a guardian does not have medical decision-making powers, they will often have access to medical records and information, so they should be kept informed of the patient's status and progress. If the guardian has no authority to access the patient's records or medical information, it's still important that they know where the patient is so they can make sure their needs are being met and they can inform the court about the patient's well-being as required by law. A guardian may or may not disclose a patient's medical information to a family member. For example, a guardian may suspect a family member of abuse and doesn't want them to know the full extent of the patient's medical condition. Or perhaps the patient told the guardian that they want to keep their diagnosis private. Regardless, open and clear communication between the hospital and guardian is key. If the hospital is having trouble reaching a guardian who is a friend or family member, try contacting another person close to the patient to see if they know another way to reach the guardian, or maybe they know why the guardian's not responding. Otherwise, you can try contacting the court examiner. This is a person appointed by the court primarily to review the guardian's reports and make sure they're fulfilling their duties, but they may be able to contact the court to express your concerns or get in touch with the guardian to understand why there's a disconnect. Their contact information is listed in the court's order. The hospital can also reach out to the court directly. Most judges have court attorneys who will take any allegations that the guardian is shirking their duties very seriously. You can find a court directory in our companion documents. A guardian's level of involvement may vary. You may feel a guardian is communicating too little or maybe sometimes too much. Discussing expectations is good practice because clear communication is only going to help.
We mentioned two main types of medical decision-making power, routine and major. How do you know what this means? Typically, anything that does not require an invasive procedure or significant risk is considered routine. This includes things like vaccines, giving antibiotics or pain medication, blood draws or tests, and diagnostic scans that do not require surgery. Major medical decisions are usually anything more invasive or that come with significant risk, like any type of surgery or chemotherapy. Whether routine or major, the guardian may do a risk-benefit analysis before making a medical decision for the patient. The guardian is also required to follow any known wishes, preferences, and desires of the patient when making any decision. So, what are the practical considerations when guardians make medical decisions for a patient? Guardians with medical decision-making authority can consent to treatment on behalf of a patient, but they cannot force the patient to comply with treatment. For example, the guardian can consent to topical medications or creams, but a patient cannot be physically restrained if they are refusing administration of the medication. And since a guardian must take into account a patient's wishes, they should not consent to treatment if they know the patient would object to it. For example, if a patient would refuse a blood transfusion based on religious beliefs, a guardian should also refuse that treatment on their behalf. However, a guardian can help brainstorm options for non-compliant patients. Perhaps a different form of medication can be administered, or the guardian can provide incentives for the patient to comply, like a favorite magazine or food item. If a guardian does not know a patient's wishes and cannot learn what they are, the guardian must make medical decisions based on the patient's best interest. The law guides how the guardian determines the best interest of the patient. Some factors include extending the patient's life, improving the patient's health, relieving the patient's suffering, and any adverse side effects of a potential treatment. What about end-of-life decisions? These decisions are related to a patient's treatment when they are nearing the end of their life. They often center around whether to continue treatment to sustain the patient's life or whether to stop all life-sustaining medical treatment in favor of comfort care. Earlier, we talked about major and routine medical decision-making powers. We interpret the term major to include end-of-life decisions. After all, what is more major than decisions about life-sustaining treatment? There are some judges who believe end-of-life decisions must be explicitly granted in the guardianship order. Some judges will even include language excluding end-of-life decision-making powers. In that case, the guardian must request the authority to make such decisions in the future. Consult the court's order and speak to the guardian to find out if they have this authority already or if they need to go back to court for it. If you have further questions about a guardian's medical decisions, contact your hospital's legal counsel and/or ethics board. If a guardian does need to make an end-of-life decision, how do they do that? Under the Family Healthcare Decisions Act, a guardian must confer with two medical professionals who must independently agree that treatment would be an extraordinary burden to the patient. Additionally, one of the following must be true. 1, even if the patient were to receive treatment, they would have less than 6 months to live. 2, the patient is permanently unconscious. Or 3, Treatment of their illness would involve such pain or suffering that treatment would be considered inhumane or extraordinarily burdensome under the circumstances. If the patient has a medical order for life-sustaining treatment, or MOLST, the guardian should treat each portion of the MOLST form as a separate decision. Do not resuscitate and do not intubate orders may be appropriate in a patient's situation, but antibiotics and IV hydration may still be beneficial to the patient as comfort care. As always, the guardian must follow the known wishes and values of the patient when making these decisions. If the patient would have wanted to be kept alive at all costs, then the guardian must fight to ensure those wishes are followed. Neither the guardian nor medical staff should let personal preferences and feelings cloud decisions if the patient expressed clear preferences. Thank you for joining us for this video. Here are some key takeaways we'd like to leave you with today. A guardian doesn't always have medical decision-making power. Check the order and judgment to find out exactly what a guardian's powers are. Routine medical decisions are generally those that don't involve invasive procedures. Examples include vaccines, administering medications, and blood draws. Major medical decisions are generally anything more invasive or that come with more risk, like surgery or chemotherapy. Since medical conditions are dynamic and complex, it's a good idea to share information with a patient's guardian so they can be prepared to make decisions as they come up. Some decisions may require court approval first. Some courts consider major medical decisions to include end-of-life decisions, while others do not. Check the order and judgment to find out if end-of-life decisions are included in a guardian's powers. Do your best to be gracious with one another. Everyone is working for the patient's benefit, even when they disagree about the patient's care. If you have more questions about Article 81 guardianship, please reach out to our helpline. We provide information to the public as well as professionals and are available by phone, email, and online.